been over the last couple of weeks? Have there been any big trends or questions that have popped up for you with any clients?
Trends, I'd say sciatica is up right now. I don't know why that is. I'm guessing more sitting, but yeah, that's trending. What about you?
Exactly. Between yesterday and today, I have seen 4 people with prominent sciatica. The one who just left, actually, is a new client coming in with sciatica. It's all the same. Not all the same. I mean, like, the story is similar in terms of whenever I get in the car, it's awful. When I sit, it's awful. And it just pulls straight down the leg. So that has definitely been
Trending.
Consistent over here too.
Yeah.
What do you think? Maybe we can dive into that a little bit. Are there some postural trends with these people that are similar, or do they have different alignments generally?
Yeah, I'd say if you split the body in half, like the left and the right side, they're not working evenly.
Mm-hmm.
So, and more so, that's usually why, not all clients, but with sciatica, it's traveling down one leg way more than the other. Sometimes it'll move, but yeah, like an asymmetry left to right.
Mm-hmm.
Typically, like even having them do like a weight distribution test, they're like, oh wow, I feel way more weight on my right leg than I do my left leg. But that's like a good indication too, that they're not loading the body evenly.
Yeah. I would say the same. Everyone who has been dealing with sciatica, all of them are feeling it down the right leg, and it can be different for other people for sure, but we have a trend right now where it's down the right leg, and all of them have a left hip elevation and a rotation in the lumbar and in the pelvis, like a twist, where the belly button is pointing toward the side that has the sciatica. So their hip is a little tighter, their femur is a little more externally rotated, and the opposite hip, in this case, with all 4 of them, the left hip is elevated. So to your point about hip asymmetry, when you then sit on imbalanced hips, like whether you're at your desk or in the car, you're going to be exacerbating the compression. So that is definitely a trend here for you.
I've been seeing like a lot of left hip elevations as well.
Really?
About it. Yeah. And I think of like people that drive too, you know, like for long distances and like have one leg propped up. It's like that over time can definitely be
a contributing factor. Yes. Hey, Jen. One of my friends just jumped on. Amazing. Hi, Lisa.
Hey.
So for those of you who just joined, we're talking about how right now we're seeing sciatica trending quite a bit in in both clinics. So definitely, if anybody on here has any questions about sciatica or their particular experience, feel free to plug that into the comments. What about upper back position? Has there been a trend with?
Yeah, I'd say like a lot of kyphosis going on. So like rounding in the upper back and just like frozen thoracic. So it's just like stuck. You need like a jackhammer, like get in there.
So is it sort of like now the upper back has kind of taken over for what the hips aren't doing? Are they pretty upper body driven?
Yeah. Like I feel like we're seeing a lot of spine driven movers versus like no pelvic movers.
Yeah.
Or like you put them into a hang position and it's like 2 separate pieces to one hole, you know?
Yeah. Like the upper back is really flexed when they bend forward, but then the low back is flat. Do you want to show us?
Yeah.
You're flexible. You can probably.
I'll pretend to be not flexible.
Yeah, exactly.
Okay.
Yeah,
so
and maybe show what bending.
Into the hang position.
Yeah.
They're like.
Yeah. And even there, like you have the hip hinge. There we are. Show what it can be like when someone tries to stretch forward just from their back versus from their hips. Right. So notice here when Chrissy is doing this, when she's doing this,
and we'll see the knee bend.
And you'll see the knee bend because the hip and pelvic hinge is stuck. So you're using your spine to do what your hips should be doing. That's what we mean when we say that. And then there you go. That's the hip hinge we're looking for. So this is taking us down a good route here. A lot of times when you bend from the spine, the way Chrissy just demonstrated, what ends up happening is frequently these people say they have tight hamstrings. Actually, Chrissy, this posture is super helpful because when you bent forward like that and you softened your knees, what muscle group shortens?
Hammy.
The hamstrings. So the hamstrings are actually responding to lack of pelvic mobility versus you can't stretch because your hamstrings are tight. Your hamstrings are tight because the pelvis isn't hinging. So we have to like reverse the cause and effect because the hip hinge is key for getting people out of sciatic and back pain, right?
Yeah. And then also what we'll see from like the front view is like if someone goes to hang and let's say like my left hip is up.
Yeah. Yes. Wonderful. A gorgeous demonstration. Yeah. And that speaks to like when Chrissy showed that and then she's leaning over to the opposite side, that's because the hip she's leaning away from is not properly flexing. And so every step you take in your gait pattern, if you can't properly flex that hip, the whole trunk is going to offset over to the side, typically the side that has the pain, right?
Yes. Or we'll see that like gait that looks a little bit like this, where they're like,
oh yeah, that Trendelenburg.
A little teeter-totter.
Yeah.
It's like a waddle.
Yeah. Yeah. And these are all exaggerated for the point of example, but these are all signs of like, if you're noticing that maybe your gait looks a little bit like this, or you're like, hey, actually, I don't feel like I'm very flexible when I stretch forward. It doesn't mean there's anything wrong with you. It actually just means we need to restore proper hip position and function. Seriously, that's Jay. That's really funny. I think, Jen, are you talking about your husband? I think so.